Welcome. Thank you so much for joining our webinar this afternoon. I'm just going to start out with a few introductory slides before introducing Dr. Abbey, our presenter today. All right, so welcome to CRAN's third session of our Empowered webinar, which is a patient education webinar series in honor of Colorectal Cancer Awareness Month. We are absolutely thrilled to have you joining us here today, and thank you so much for spending a little bit of your day with us. I wanted to take a moment to just introduce CRAN for those who may not be familiar with us. So the Colorectal Cancer Resource and Action Network, more affectionately known as CRAN, began really as a grassroots colorectal cancer information and support group back in 2006, a few months after the passing of our founder's father. Today, CRAN has proudly grown into a national, not-for-profit, patient-focused organization. We are governed by an experienced board of directors and counseled by a really superb expert medical and scientific advisory board. At CRAN, we actually have two patient advisory councils, one of which is dedicated to the early age onset patient population, and their perspectives and their lived experiences with the disease are actually so impactful in helping to inform and guide our program development to really ensure that our programming and our services remain relevant and meaningful to those whom we support. In terms of our mandate, CRAN champions the health and well-being of Canadians touched by colorectal cancer and others at risk of developing the disease. And we do so by providing support, education, and advocacy to patients as well as their caregivers to help improve quality of life and longevity. CRAN has expanded our patient-focused mandate, and we do so to serve multiple tumor type patients through our HTA patient evidence submissions, our educational events, advocacy initiatives, and now our patient programming. And we do this all with the ultimate goal of reducing the burden of cancer in Canada. We also want to just take this opportunity to encourage you all to register for Bum Run. So Bum Run is a 5K walk-run event taking place in Toronto, Calgary, Halifax, Vancouver, and virtually. Bum Run is a critical annual fundraising event for CRAN, and it also provides the opportunity to spread much needed awareness about colorectal cancer and the importance of screening. This event is for all levels of ability, but in the event that you are unable to attend, you can still fundraise or you can donate. The funds raised will go towards supporting CRAN's patient programs, and we would be so very grateful for your support. Now, we are still going strong with our Colorectal Cancer Awareness Month activities, and we encourage each and every one of you to be a champion for colorectal cancer awareness. By raising awareness amongst your family, your friends, your professional network, and your community, you can save lives. Please keep up the great work and utilize some of our resources, like the ones you see here on the screen, that have been shared via email and social media. Now, a few housekeeping notes as we begin. So your mics are automatically muted, and we ask you to remain this way throughout the presentation. Questions can be submitted via the chat function or the Q&A. You may also raise your hand at the end of the presentation to ask a question. Today's patient education session is being recorded and will be shared for the benefit of others. So mindfulness can help patients and families better cope with the feelings of uncertainty, the lack of control, fear, and discomfort that often accompany living with cancer and beyond. Dr. Susan Abbey has joined us today to share with us the benefits of mindfulness-based stress reduction interventions and mindfulness-based cognitive therapy. She will teach us how we can all practice and incorporate mindfulness into our daily lives. Dr. Abbey is the Program Medical Director for the University Health Network Center for Mental Health, the Psychiatrist-in-Chief for the University Health Network, and a professor in the Department of Psychiatry at the University of Toronto. During the COVID pandemic, she has led the development of programs for healthcare worker resilience and mental health. She has taught and researched mindfulness-based stress reduction interventions and has more recently trained in mindfulness-based cognitive therapy to prevent depressive relapse. Dr. Abbey has been active at a health systems level in advocating for improved mental health care for the medically ill and improved access to mental health care through her roles as president of the Ontario Psychiatric Association, president of the Canadian Psychiatric Association, and president of the Canadian Academy of Psychosomatic Medicine. She is an award-winning educator, and we are so pleased to have her with us today. And with that, I'm very pleased to hand it over to you, Dr. Abbey. Welcome, and thank you so much for joining us.
Thank you, and I hope I'm going to get my slides up right because I always do this wrong. Are we good? Oh, we're good. We're good. We're good. Can you see them?
There, yeah, you're
Yay.
perfect.
So I was before we started, I was saying to Cassandra and Himanshi, I really feel this is a cause dear to my heart. I've had a terrible orthopedic injury, and yesterday my sister, because I'm not weight bearing, so she helped me get up to see the surgeon at Sunnybrook, and but she was there 14 years ago, dealing with her rectal cancer, and she's 14 years out now, and it was a terrible time for her. It was a terrible time for her kids, for her families. But she's happy and healthy, and so it's very exciting. It's an area that huge progress is being made in. I'm going to talk today about using mindfulness-based interventions, and I had also asked Cassandra, I said, are we a small enough group people could kind of ask questions? And she said, no, we're trying to, so we can, film this and use it for more teaching. But I remember like a couple of years ago when I did this, one of the guys broke in right now and said, I thought this was all horseshit. I thought it was just like fluffy, crazy stuff, and I wasn't going to do it all. And then I found out about it, and this really helps. And I said, yes, it does really help. So when doctors give talks, they always have a disclosure statement. And I always say no disclosures, like I'm not making money from this, but I am passionate about this. And the reason that I'm passionate is because it's really helped me. It's helped me to be more calm. I used to be really anxious. It's helped me to be more focused. It's helped me to see what the challenges are in front of me more clearly. And that has been a huge help since my literally moment of inattention and my fight with the black ice on my stairs at home. And now I'm like 15, 16 months into and multiple surgeries. So it really helps to kind of see what the challenges are, to know kind of what needs to be done, to pursue it, and to pursue it in a way that's less emotionally reactive. That all of us have the tendency to kind of our moods to go up and down, to get more or less distressed, more or less pulling out our hair. But the mindfulness has really helped me to be less emotionally reactive about things where emotional reactivity isn't going to help me. And I use mindfulness-based approaches to help me sleep better, to cope better with medical and dental procedures. The hygienist at my dentist's office says, you do something while we're working on you, don't you? Because she says, I feel something sort of different. And I said, yes, I do. And I had a long thing done before my fall. And she said, you've stopped doing whatever you're doing. Can you start it again? Because I like the way it feels in the room. So it's very interesting. That does sound, I know, woo-woo, but it really is very helpful. It helps me deal much better with situations that are outside of my control. And the most important thing, I think, and the reason that I would encourage you to explore it if you haven't already, is because I think so often when we're faced with painful or difficult situations, that what we do is we pour gasoline on the fire. And it's really helpful to me to not add more suffering. That the suffering with whatever the suffering is enough. I don't need to add more to it. So those are the things that are helps. So I'm going to I got some learning objectives from CRAN too, and I've got mine, and I'm going to just try to give you a overview of the kind of opportunities and some of the good resources in the area. So I'm going to define mindfulness and distinguish it from some of the relaxation therapies. I'm not anti-relaxation therapy. I think they have a huge role. With my own orthopedic injury, I've been exploring something called yoga nidra, which is really helpful around kind of resting practices. I'm going to tell you about some of the formal meditation practices, and then just things that we can do moment to moment, day to day, that can be really helpful in cultivating our capacity for mindfulness. And then I'm going to describe some mindfulness approaches that have been really helpful to patients and families coping with cancer. So there's a great saying that people apparently was on a poster at one point. You can't stop the waves, but you can learn to surf. So we're going to talk today about surfing and the kind of, this is where the metaphor breaks down a little bit, but in less rough waters, right? But there also, if you do this enough, you know, the waves get bigger and bigger before they knock you down. So it can be really helpful. Now, this is a great quote from Viktor Frankl. He was a neurologist and a kind of psychiatrist, psychoanalyst in Germany in the and was in the Holocaust. And he said that he always reminded himself that between stimulus, whatever it is that's going wrong in our lives, or whatever pressure or stress has come to bear, and our response, there's a space, right? Sometimes it's like this, sometimes it's like this. But in that space, in this area, that's our power, because we get to choose our response. And then in our response, you know, lies our growth and our freedom. And I love that. And so partly I think what mindfulness is doing is about trying to increase the space that just, you know, I know something has happened. It's really upset me. I need to respond to it. Let me choose a response that's going to be helpful to me, you know, helpful to the people that I love, helpful to the healthcare team that I'm working with. So there are lots of challenges, right, around a cancer diagnosis. I don't need to tell you the uncertainty, the lack of control, the threat of mortality, the waiting, the waiting, the waiting, the waiting, the waiting, and the waiting. I was talking, my sister, while she was getting her treatment done, she used to buy herself what she called her cancer jewelry at Sunnybrook. And I said, I was so disappointed because I thought I was going to get orthopedic jewelry, but they're not around where I can get to, and I can't get very far. But you're always waiting. And so I often use mindfulness-based interventions while I'm waiting. Can be very helpful in working with discomfort or with pain. It's really important to have your pain medicines, right? But there are also things that you can do that that help with investigations and treatments. And I used it. I needed before Christmas, I had to have a PICC line put in, and I was feeling scared about that, but it went fine, and it's very helpful. And strong emotions in oneself and others. So there are two books that I think are really, really good. And this one by Linda Carlson and Michael Specka. They are both psychologists. They come from Calgary, Alberta, and they've taken something called MBSR, or mindfulness-based stress reduction, which was the very first of the mindfulness-based interventions. And they've taken it and they've specifically adapted it to help both cancer patients and their families. The thing I love, love, love about this book is that they have also really worked hard to think about what practices may be most helpful for what symptoms. So you can look in the book, and if your issue is fatigue, or if your issue is nausea, or if your issue is pain, or you've got all of them but at different times, you can look in there and see practices that are going to be particularly helpful to you. So I think that's an amazing book. The other book is this is a more UK perspective on things. It's called Mindfulness-Based Cognitive Therapy for Cancer. So after MBSR, the next mindfulness intervention was mindfulness-based cognitive therapy. And it really is about how kind of we're aware of what's going on in our heads and our bodies, how we can work with thoughts that are distressing to us, how we can sort of reset our nervous system. You know, they've got like a 3-minute breathing space. It's fabulous. And so again, this book is really helpful, but written from the more UK perspective on things. So when I say mindfulness, some of you know what that means and you're doing it. The other thing I'll say is, you know, when I started teaching mindfulness, it was really hard to find things, and people would get like a little scrap of paper and then they would photocopy it and give it out to people and everything. Now, if you've got access to the internet on a laptop or on an iPad or on a phone, you can find literally thousands of examples of each of the practices that I'm going to talk about. So it's really helpful. You can try stuff out. You can see how it works for you. How does your mind respond to it? How does your body respond to it? And then kind of figure out who you're going to be a groupie to, and start watching more of theirs, because that's really helpful. So there are two forms of meditation. A lot of us think of what's really a concentrative form of meditation. And the probably those of us who are older than 60 will remember the Maharishi Yoga, or maybe 50s will remember it too, but the Maharishi Yoga. And you wanted to bring your concentration down to one point and try to just hold it there, and anything else came up and you just tried to bat it away and just stay at your one point. Very helpful in terms of relaxation, very helpful in physiologically calming, soothing the self, taking down the heart rate, blood pressure, respiratory rate, those sorts of things. Mindfulness tradition is a little bit broader than that. It kind of wants to be able to just to be in the present moment, to know what's happening with my mind, what's happening with my body, and to know what a wise response, to give myself enough space to figure out what's a wise response to what's going on. And then there's for those of you, we won't do the practice today, I think, but you can look up concentration meditations, mindfulness meditations. The other meditation that a lot of people are talking about now, and some people kind of put it under mindfulness and some people separate it out, but there are a series of meditations that are about repeating positive intentions for oneself, either to be kind, to be compassionate, to take joy in when it's available, either in my own life or in somebody else's, and to have a sense of equanimity. And those are called in the Buddhist tradition the Brahma Viharas, or 4 kind of heavenly abodes, because they feel nice and they're good. So we'll talk about them maybe just before we end. So this is a 30-year-old definition, but I think by the founder of the mindfulness-based interventions, and he said mindfulness means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. The non-judgmental part is hard because and they will talk a little bit too about acceptance. It's not oh yeah, it's okay that you're, I'm kind of trash talking myself and I've got a terrible inner monologue. No, but it's important for me to know that if is what's being evoked in the moment, right? So can I see it as, oh dear, I'm really being mean to myself. How am I gonna try to shift things to be kinder in this moment? Right? So that's what the non-judgmental part is. It's not that we're giving up on liking things when we're feeling better more than we like things when we aren't, but it's being able to kind of know things and then be able to respond to them. Chris Germer, who's done a lot of this work, he says it's awareness of present experience with acceptance. And again, it's not like acceptance like, oh, I'm really glad I've got colorectal cancer and somebody's sticking something up my bum. No, it's kind of, but like that's what's happening. And so what can I do in this moment to decrease my own suffering and distress and really kind of take care of myself, be compassionate and kind to myself. So it's a little bit like that. We'll do a quick, I'll get my phone on here. Like there are two ways of experiencing your feet. So let's just for a moment, I'm going to ask you to just bring all of your awareness into your feet. And I want you to think about your feet and like, do you like them? Do you not like them? Are there things that you change about them? What doesn't work so well about them? And what does work well about them? And then what I'd like you to do, take another kind of, maybe one or two deep breaths just to shake your kind of attention and energy up a bit. And then I want you to bring your awareness to your feet and just notice how your feet feel today. Are they having any sensation in them? Do you notice it? How many places is there something? And can you just be with them? Think about what what's happening in them right now. And then just coming back and thinking about the sort of the two ways of doing that, right? There's one that is very focused on doing, like on really like evaluating those feet, figuring out what works, what doesn't work, noticing that there's a gap or a discrepancy between like kind of how you really want them to be and how they are. And the other one is just like, man, I got feet, right? And this is how they feel. And if you pay a lot of attention, a lot of people like the feet as a focus in the mindfulness because they're sort of always there and they're often, quite quite helpful. But they're there. It's a kind of doing mode of being. And so we're really trying to move into that doing mode of just like kind of knowing what's happening, not always having to get somewhere new with things. Shapiro's and Carlson have said, what's confusing is that we can use mindfulness as both a process, so like we're, mindful practice and an outcome. So that makes it confusing. And just to be completely upfront about it, I always tell people these are adapted really from traditional mindfulness or Vipassana meditation practices. They originate in the Theravada and Mahayana Buddhist practices. They're 2,500 years old. It's all described in something called the Abhidhamma, which is a compilation of Buddhist psychology. Having said all that, because I think it's important that people know that, it is not a religion. It is not, you don't have to have a guru, you don't have to have a shrine room, you don't have to have things, up on the walls. And it's a way of being that has sort of proved itself for a very long time. I mentioned earlier these sort of heavenly abodes and being kind to oneself and everything. The Buddha actually developed that kindness meditation, loving kindness towards yourself and others meditation, because he said if you evoke those feelings, they're incompatible with fear. And so he was using them and teaching his monks to use them so that they could go from monastery to monastery and be out in the jungle and, where it'd normally be very frightening. But if they did that, it helped. I do a lot of loving kindness meditation for my own like medical and dental care. And that's what I think the dental hygienist is somehow feeling that my kind of state softens with the loving kindness. So you don't have to sign up to be Buddhist. And that's a major take-home message. Now, some people intrinsically are very mindful. And I think if you think about this after the talk today, you'll think about, oh yeah, like my Aunt Mary's like that, or my kid's friend is really like that. Like they're just people that feel kind of grounded, calm, in the moment, know what's happening, know how to be helpful. And then there are people who are like, I love those, things at in front of the car dealerships, those like kind of balloon people, like, who are just freaked all the time. So, and we all fall somewhere on that spectrum. What has been really helpful, I think, about mindfulness is that, when I go back many years ago to my undergraduate psychology days, whether you were like the kind of balloon person or the focused calm person, was really thought to be about your temperament and about you were born with it, and there wasn't much you could do to change it. What we know now is that you can actually cultivate these capacities. You can cultivate them either using formal meditation practices that we talk about, or it can be focusing on just developing mindfulness in daily life. Just, when I turn on the water, I'm going to really be there for that. Or when I brush my teeth, I'm going to really be there for that. And that will help us to become calmer and more centered. So there are lots of things that we can be mindful of. So all of us carry our breath with us all the time, and that can be something that's very, very helpful, and very helpful if people are doing unpleasant things to us. We can kind of retreat from wherever the area of unpleasantness is, just to our breath, and try to really focus there. We can focus on physical sensations. We can actually learn to work with problematic physical sensations. And so that was what I was talking about with the book by Linda Carlson and Mike Specca, of how to work with those sensations so they become less unpleasant. We can work with our general feeling tone, whether things feel pleasant or unpleasant or meh, our thoughts, our emotions, and then kind of underlying principles of experience, which is a sort of a fancy way of, like, you start to see the relationships between, like, if I'm snarky to her, she's snarky back to me. So let me try to not be snarky. Or seeing that, if I worry a lot about things now, it doesn't actually change the outcome. So maybe can I work on pulling back some of my current moment worry? Whatever is going to happen is going to happen. So people will work with those things. And then these are some of the formal plant things, practices people can do. There's something called the body scan. I recommend everybody try one. Some people will absolutely hate it, and some people will love it. And that's the same with the mindful yoga and with walking meditation. Or you may just sit. But I think one of the things that's really important is for people to find what works for them, because not everything works for everybody. And there's actually a really brilliant scientist in Germany now who's doing a whole series of experiments that actually show that you can take a functional MRI brain scan, and based on that, know what's going to be most helpful to them. Now, obviously, we don't have access to that in day-to-day practice, but before we stop today, I'll show you a website that you can look at, and you can just try stuff. And, you try 4 or 5 of them, which might take you, if you did one a day, it takes anywhere between maybe 10 minutes, 7 to 15 minutes. You'll know by the end of the week kind of what vibes you, what helps you. Or you might find that there's certain things that do certain things for you. So, like, I know that if I'm really anxious about something that includes the body really helps me. And that's because we know the neuroanatomy and the kind of neurophysiology of things, that it actually helps move you from a anxiety track to a more physical track. So I know that if there's a lot of anxiety, I need something more body-based. I know the walking meditation is like my ultimate groovy thing, although not right now because I can't walk. So, I've been working with sitting meditation. I do a lot of the loving kindness and the compassion-based meditation. So it's finding out what helps you. And then there are also people who do much better with just finding lots of informal things to act as means of recentering. to bring themselves back to the moment. So to eat mindfully, or to have the first bite or two really mindful, to know I'm eating, to know what's on my fork, to really taste it rather than just sort of inhaling the food. At times, just during the day, using the breath to center back, or knowing like, oh, I'm getting too much. Let's just, do a MBCT 3-minute breathing space. There are a ton of 3-minute breathing spaces on YouTube, and you can also find like 3-minute breathing spaces that have been taken down to 1-minute breathing spaces and expanded to like a half-hour breathing spaces, but lots of those. You can do things like common daily events. So like when the telephone rings, don't answer it the first ring. Just take that first ring as a call to where am I right now? How tense am I? How do I feel in my body? How do I feel in my mind? And then answer on the second or third ring. And you can bring awareness to any daily activity. One of the things that a lot of people in our groups do is bring it to their toothbrushing and to also oh, I'm forgetting the word for it when you clean the teeth. Uh, and flossing. Thank you, Cassandra. Yes, and the mindful flossing, and then they go see their dentist, 6 or 8 weeks later, and the dentist goes, "My, what are you doing with your mouth? It's never been better." So, those kinds of things can be really helpful. But it's just a chance to just do something, be fully present with it, and really kind of know what's happening. It develops lots of good perspectives on things. That gives us patience, it gives us trust in our own being, it gives us a sense of openness and curiosity. I found it particularly helpful for me in learning to let go. I could just have thoughts go around and torment me, and that was when I really knew this was helping. I had been doing some work in it, but I had an incident, and I was just that I can either hold on to this or I can let it go, and I could let it go, and it was like, whoa, this is like magic. We're trying to be gentle and kind, non-reactive, meaning more responding, that we're, instead of being automatic and flying off the handle, we kind of bring some wisdom to it, and we treat ourselves with kindness. We accept things, and that we see this is the way things are. Not that I have to like it. I don't like it, in fact, but I know how it is. And knowing how it is opens up a whole lot of more doors for me in terms of what I might or might not do with things. We try to develop this sort of sense of non-judging, that I can just know. Like, I know I'm grumpy, or I know I'm sad, or I know I'm in pain, or I know I'm tired today, or I know whatever. And then I can think about, how do I take care of myself, which is super helpful, rather than just like kind of pushing it away, avoiding it. Non-striving and non-attachment, that we're just kind of allowing processes to unfold. So people have been using this in a lot of different areas, and cancer has been one of the really big ones, but also pain and cardiovascular diseases, sleep disturbance, a lot of work in HIV and AIDS. There's some very beautiful, I haven't seen these in cancer, but I have seen them in AIDS, but there are some beautiful, like mindfulness of medication, like take your pills with kindness, that you're taking them into your body and that they're going to help you, rather than like, oh, I hate taking these damn pills, right? And it really changes the quality of day-to-day life. So the thought of how it actually works is it probably does it. So they often use the term detached observation, that it just gives you this little bit, and I think of it in the space, but it just gives you this little bit of ability to watch what's happening. It's clear that these practices improve people's positive affects. They feel happier, calmer, more content, experience more joy. And they also seem to provide a greater sense of coherence, that life is more comprehensible and manageable and meaningful. I'm just going to bop ahead. So this is an example of the bottom is like what most, or at least certainly I would do. I do it with my leg. This pain is excruciating. I can't cope with it. It means the tumor's bigger than they said. It'll kill me. I can't stand it one more minute. I usually say, I can't cope with it. It means that my leg must be really buggered up and I'm going to have it chopped off, right? Or you could say, I've got this really difficult pain. It is really strong, and then it's less strong. And look at it, if I watch it for a couple of minutes, there are these times when it's okay. Could I just rest in the okayness instead of still being really upset? So people will use that. So I think that people can make choices about how to deal with physical pain or symptoms. There's the realization the pain is not me, that there's something deeper in me that is able to connect to the people that I love and to the world that is beyond the pain. And having that, right now things suck is much more helpful than trying to either control or avoid or sort of push things around. And there's a lot of neuroscience work that has really demonstrated that there are distinct effects of both attention and affect. So if you're depressed, if you're anxious, your pain perception is worse. We start to get in touch with our thoughts. We see that thoughts come and go, that they may or may not be true today. That maybe they were thoughts that were accurate, or they were what people were telling me when I was a kid, but they don't suit my life now, or they don't suit my life as a patient right now. I start to see that there's something that's again beyond my thoughts. I'm not my thoughts, and I can let go of them, and I can be aware of this moment and hang out here and feel better here. And then similarly with emotions, that emotions come and go. They're like clouds in the sky. You're not your emotions, and you can observe emotion, you can develop skill in letting it go, and you can, be aware of the present moment. So all of those things are really helpful. This is another book that's coping with cancer. This is DBT, which is something called dialectic behavior therapy. And it came out of the mindfulness tradition, DBT, and it helps you to actually manage particularly emotions and balance uncertainty with hope. So this book is much more focused, and Marsha Linehan, who's the co-author on it, was the person that founded DBT, but really much more focused on the kind of the emotions and the thinking aspect of things, a little less so on the physical, but it's a great book. So people, you might do something that's specific, like one of these cancer programs. You might do something broader, like both mindfulness-based stress reduction and mindfulness-based cognitive therapy are quite similar. MBSR was devised by John Kabat-Zinn and his colleagues at the University of Massachusetts, and they've had lots and lots of people participate. It varies depending upon the teacher. Typically, it's 8 classes of about 2.5 to 3 hours. You think like, oh my God, that's like forever, but they really go quickly. And there's usually an intensive class of 6 to 7 hours, often between week 7 and 8, and or week 6 and 7. And they, depending on the program, some of them will have individual intake and exit interviews, and some won't. They are quite heavy in the homework. These guys are heavy duty. They do like 45 to 60 minutes a day of homework, and you can have very large class sizes. So you can have 25, 30 people. It's usually limited more by the room size than other things, and people will often do self-report measures so that they can see their progress. The fundamental philosophy is that as long as we're breathing, there's more right with us than wrong, and whatever problems we have, we can work with them, and that we work with them by saying, this is it, what's the reality of the present moment, and then how do I make a good choice? Because the present moment is the only moment that I can learn, that I can grow, that I can change, that I can take care of myself, that I can eat healthier, that I can do anything. It's now. It's not like 3 weeks from now, it's now. So how important the present moment is. And they teach a bunch of the things that we've already talked about, but I'll also do an eating meditation with raisins. They have the mindfulness events, and we also get people to look at difficult communications and pleasant and unpleasant events in the day, and how you can make more pleasant events or fewer unpleasant events, potentially by making some choices. MBCTs are smaller classes. Usually they're about 8 to 12 people, and they have the same kind of 8 sessions and an intensive. there's homework, but it's less, and there's much greater focus on working with the challenging thoughts. It's interesting though, all the benefits from MBSR seem to be present for MBCT. So one of the other things that people are sort of trying to research is like kind of what's the minimum that you need to be able to get benefits. I mentioned about mindfulness and loving kindness. I'm a big proponent of this, and if you put in loving kindness, you will again find, you know, a bazillion things on the internet these days. It comes from a ancient Pali word, and it is this notion of kind of friendliness, love, benevolence, goodwill, this kind of all-embracing caring. It's often referred to as metta meditation. And it was traditionally seen as a concentrative meditation because you're repeating phrases again and again. So you do have that kind of concentration, which helps. But there's also a piece because you feel your body as you're doing it, and you realize, like, for some people you don't feel fine at all, and for other people you feel very open, and you start to get a sense of, how am I towards myself? And you know, can my heart be kind to me or not? And then, you know, there are a bunch of various programs that help with those troubles, and usually the phrases are about safety or freedom from danger, or I really like inner and outer harm. A wish that I have physical health, or that I may be healthy and strong. Or one of my favorite teachers who's in her 80s now, she says, "Oh, forget having that. Let me just feel that." You know, it could be an aspiration for me, that I could have a sense of mental health, and that I could have an ease in life and an ease in caring for myself. It's one of the things that I admire most about my sister. She's gotten so good at, she had to have an ostomy, permanent ostomy with um, her troubles, but she cares for the ostomy now, just with this kindness and calmness, and it's really wonderful. It's very matter of fact, and it happens. So, and some of that I think can be really helpful. And then you offer it to different people. You can offer it to yourself, to people who've been good to you, to loved ones, to somebody who's neutral, who you just sort of see in the environment, to difficult people or the enemy. I used to have a boss that I decided I had to do something because I was getting shin splints because I would walk. I was so mad with him. And then you can also offer it to larger groups of people, to everybody suffering with colorectal cancer, everybody suffering with cancer, everybody with health problems, everybody who's suffering in some way in the world, all living creatures. And it has a very generative, a lot of people liken it to a sense, for people who have a religious background, they often liken it to a sense of the kind of a feeling good with praying, but it's not a prayer specifically. So other people just, you know, find that they really come to like it, and it's very helpful for them. It's particularly helpful in developing a compassionate stance towards the self and others, and enhancing the sense of interconnectedness and interbeing. And that, I think, for medically ill people is often really helpful. Like I've really felt connected with all of the people that have had challenges like I've had. And then sometimes I start thinking, and how lucky I am to have them, you know, in Canada, where I can get good medical care and I don't have to bankrupt myself and my family, and all of those things that bring a source of kind of comfort and calm and good feeling. Some people describe it as they feel that they are almost like praying or offering something out to others, and that's very appealing to them. And it's something that's very helpful to use during difficult times like tests and procedures. And I love this quote from the Buddha. We're almost at the end. The Buddha is reputed to have said, "You can search the whole world over for someone who is more deserving of your love and affection than you are yourself. And that person is not to be found anywhere. You yourself, as much as anyone in the entire universe, deserves your love and affection." And I just love that, because I think so many of us have been brought up to take care of everybody else first. And this is a real reminder take care of me, right? And if I take care of me, then I'm calmer, I'm happier, the people that I engage with are happier, and on this sort of circle goes. So I'm hoping that there's something here that you might be able to incorporate into your daily life or your work as a cancer coach. Where to learn more? So again, these books, the Carlson Specka book and Trish Bartley's Mindfulness-Based Cognitive Therapy, and Stunson Linehan's Coping with Cancer, DBT Skills, those are really helpful. What I was going to suggest, my absolute favorite thing in the world to do for no cost is to look up the UCLA Mindfulness Research Center. And they have two things on there. They have some mindfulness-based practices that people can try, and they're anywhere from like 5 minutes to 15 minutes. I will often give patients of mine like that thing and say, go home and try them all, and then come back, next week or in 2 weeks and tell me what speaks to you. And then once we know kind of what works for them, then we can, go further. Both Google and YouTube have lots of stuff. John Kabat-Zinn, I adore. There's a John Kabat-Zinn at Google, where he went to Google and talked to them about this. But anything that you can see of John Kabat-Zinn's really helpful. And there are some meditation apps that are for free. There's some things that you have to pay a subscription to. Some of our folks just can't afford it. Some of them can, it's probably around between maybe $50 and $100 for a year. But the sort of big three are Calm, 10% Happier, and Headspace. I think 10% Happier, I should have updated the slide. They've just changed themselves, I think, to 10% or something, because I think you're 10% better in all sorts of ways. But those online resources are super helpful. And also happy to take any questions to me. Oh, and I'm sorry, it shouldn't, we're now just uhn.ca. I should have changed that. So I will change that, and let's open the floor for questions, and I will stop sharing so we can see each other.
Thank you so much, Dr. Abbey. That was wonderful. You did mention our Cancer Coach program as well, and I do want to highlight that anybody who's interested in participating in the Cancer Coach program, please just reach out to myself, Himanshi, or Christopher, and we would be more than happy to connect you with a cancer coach.